Oral anti-diabetic drug therapy intended responses is to maintain blood glucose levels within a normal range and that there is no glucose detected in urine. Side effects include nausea, vomiting, diarrhea, and rash. Adverse effects may cause severe hypoglycemia. Do not give metformin within 48 hours of any test involving radiopaque dye. It can lead to kidney failure. Do not give thiazolidine odines to any patient with severe heart failure. When administering oral anti-diabetic drugs, always check when meals will be given, blood glucose levels, vital signs and weight, and urine output. Afterwards, monitor for signs of hypoglycemia, check blood glucose levels, monitor vital signs, weight, lab work for kidney or liver functions. In teaching a patient, they need to understand to be compliant with medications for diabetic management. That is taking the medications, watching what they're consuming for food, and exercising. The drugs do not cure the disease. They only help control the disease. Here are lifespan considerations for oral anti-diabetic medications. For pediatrics, sulfonylureas, alpha-glucosides inhibitors, thiazolidines are not recommended. Metformin, megalitides can be prescribed for those older than 10 years. For pregnancy, insulin is preferred to manage diabetes during pregnancy. For older adults, many have problems monitoring blood glucose levels. There is a high risk of hypoglycemia, especially if taking beta blockers and warfarin. It may be harder to recognize hypoglycemia in older adults. And blood glucose levels may be more difficult to control due to poor eating in older adults. Drugs that increase incretins and amylin. Incretins are a type of natural hormone that is produced in the stomach. In addition to insulin, it also helps lower plasma glucose levels. Amylin is a natural occurring hormone produced by beta cells in the pancreas that works with and is secreted with insulin in response to glucose elevation. Amylin levels are deficient in patients with type 1 diabetes and in patients with type 2 diabetes who are also deficient in insulin. Examples here include
pramlintide,
The intended responses of these medications are to normalize blood glucose levels. No glucose can be detected in the urine, and weight gain. Drugs that increase incretins and amylin have adverse side effects, and side effects include nausea, vomiting, diarrhea. The adverse side effect is hypoglycemia. Patient teaching. It varies with each drug. Signs and symptoms of hypoglycemia, allergic reaction may occur. Take before main meals and not after meal. Lifespan consideration for drugs that increase incretins and amylin. Pediatrics, not recommended. Pregnancy, not recommended. Older adults, a very high risk of hypoglycemia, especially when taking sulfonylureas, beta blockers, and warfarin. A greater risk for infection at injection sites, and blood glucose may be more difficult to control due to poor eating.